Morning, everyone. Yeah, you all are highly welcome. How are you all doing? I hope everybody is doing well, right? Yeah, and I'm sure you know that we are live. So get in here and be amongst those that are going to listen to this very powerful topic. What are we discussing today? We are discussing child abuse. Child abuse, as we all know, is something that everybody must be very attentive. Why are we attentive? Because that particular child that is abused, if not handled properly, may turn up to be a very bad person when the person becomes an adult. All right? Now, listen to me. As you all know, when a child is abused, or when a person, even you that is watching me, if you were abused when you are a child, the possibility that you will abuse somebody in the nearest future is there. So that is why we need to nip it on the bud. Whenever I talk about a topic, I use an analogy, right, to talk about it. Some few months ago, Netflix, everybody know Netflix now. Netflix is the real deal. Everybody is looking at Netflix. Streamed the story of Gabriel Fernandez. Different Fernandez is an 8-year-old chap, little boy that didn't know much, but was with his mother until the mother started having a relationship. If you have not watched it, go type in Gabriel Fernandez. At the end of the day, the abuse this child's mother and the boyfriend did to this child led to his death. Somebody is trying to come in. Let's see. So when this broke up, everybody was surprised. You know why everybody was surprised? This happened in LA, United States of America. So the point is, how did this woman and this boyfriend orchestrate and did all this child abuse without anybody having an ink or knowledge or suspicion of what was happening in this little boy's life? He is 8 years old. He's supposed to be in school. So does it mean that even the teachers didn't even pay attention? Does it mean that this was happening and nobody understood that they need to be there for this little chap? Until this little chap died, no one, not even a sister, not even a brother, not even a neighbor reported this abuse. So, having said that, you all are highly welcome to my life. This is your favorite doctor, Dr. Tonia. Yes, of True Health with Dr. Tonia. Today, we are diving in to discuss child abuse. Any abuse that you do to a young chap that cause bodily harm, emotional harm, physical harm, and sexual harm to a child, all of these are termed child abuse. Because guess what? We as parents, as relatives, as aunts, as uncles, as brothers and sisters, must be in the life of our relatives, even your neighbor. Listen, that somebody is somebody's parent, like as I am now, I am a parent to some children, right? My teenagers and my toddlers are my children. But that didn't make it that if I am abusing my own child, the person next door cannot report me. So while you're there, keep an eye on that your neighbor. Keep an eye on that your friend. Keep an eye on that child that is in your children's school, especially if your children have complained to you that there's this particular child that doesn't even take his bath, that is always dirty, that will be begging for food and things like that. That is a red sign, and you must have a communication with the teachers to report what your child has given you. Because for children to talk about a child that is constantly asking for money or constantly begging for food, or for children to see a child that comes to school and they say, oh, that mommy, there's this particular child that is always smelling, that is wearing tattered clothes, torn clothes, you know that is a red flag that you as an adult should not look away. If I take a poll right now, all of you watching me on any of the social media, if I take a poll to say, okay, let us find out who and who have been abused as a child, I bet you most of you here have had one abuse or the other. Now, I have talked about Gabriel Fernandez. I am going to take it home to Africa right now. So for you to understand that there are rules and regulations in America, and still some parents get away with abuse of children, that will tell you the magnitude of this abuse, especially when it comes to Africa, that the rules and regulations are not done. Even the people that you look up to, political holders, that you will think that, oh, they know the law and they won't abuse children. They are the perpetrators of this abuse of children. Now, before I dive into the topic, I want to ask you, have you shared this live? Have you sent a thumbs up? Because we need to bring in a lot of people here. So if you have not shared it, kindly share. Those in Instagram, on YouTube and Facebook, please share so that a lot of people will come. Because let me tell you the truth, abuse is one of the things that is grievous, that is causing people, when they grow up, they feel that they have been abused and they want to abuse someone else. So when we nip it at the bud right now, and how are we going to nip it at the bud? By discussing it, by sharing this video so that other people will listen and also pay particular attention when something like this happens in their lifetime. So guys, click on that share video. If you click on that share video, I am going to see that you shared, because guess what? When you share, Facebook, YouTube, Instagram is going to show me those that share. So I will call out your name to make you know that I've seen that you've shared. Okay? All right. So I'm going to tell you what happened one of the days that I was consulting. I sat on that consulting room, and this family, a man and a husband, came in. with their daughter. I mean, I had a whole lot of abuse cases that I handled, but this particular one was striking. You know why it's striking? Because this man had this elder sister. The elder sister had a teenager. So he went, took the son of his elder sister and brought to his home against all odds, even when the wife complained that, wow, you didn't even tell me that this boy is coming so that we'll prepare a room. No, like, he was like, no, he can sleep in the same room with our children. Now, why this one is very, very important. Like I said, I had a lot of cases of child abuse, but why this one is very important to me is because this child that was abused is handicapped. Okay, the child is not developmentally okay. All right. As at the time I saw that child, the child should be about 6, 7 years, but she hasn't started talking, very well. So that's why that one I'm talking about. That one, there are a lot of them that I saw. Believe you me, when I say a lot, I mean a lot. So when they came, the mother was like, "Doctor, please, I need you to examine my child. My child is always pointing towards her vagina area, and I feel that there is an abuse that must have been done." I was like, okay, bring in the child. So when the child came in, I couldn't communicate with the child because the child was not able to vocalize. Okay. So by the time I did all my examinations and all that, it was found out that the hymen has been broken. You all know the hymen, right? That is the main thing that covers the vagina area, and it is only broken when you have been sexually active or molested. So I started asking the woman. The woman broke down. She said she was suspecting it, even when the child was pointing towards that side. Anytime she wanted to bath the child would not allow her to touch that area. And that's why she came. I said, okay, so who will you think must have done this? She said it must have to be the cousin, her husband's elder brother, elder sister's son that was living with them. And I said, okay, you know what you're going to do? Go invite that boy, invite your husband. I need to see everybody. So when the husband came, for you think a father will protect the child, right? The father was like, no, how do you mean? How do you even think that this would have happened? I'm like, excuse me, I am the doctor and I have examined this child and I have seen that this child have been sexually molested. He now mellowed down and said, okay, so doctor, what do you think we do? I said, we need to talk to the boy. The boy is out there. So you bring the boy. So when they brought in the boy, I excused them. They all left and I asked the boy what he did. He continued to lie, refused to tell the truth. I'm like, look, we have already seen what you've done. So can you confess to what you have done? So one of my nurses came on like, Dr. Koro, you are a calm person. You are very, very calm. So before you could know it, the nurse gave him a words. That's Africa. Okay. So by the time that nurse gave him that slap, he opened his mouth to start confessing. Like, okay, so how many times have you done this to this little girl? He said he can't count how many times. So I brought in the woman and the man, and he also said that in their presence. The lady broke down, started crying, and like I told my husband, I told him I didn't want anybody to come to my house, but because this is his relative, he wouldn't listen and all that. So after all treatment, I treated the child, gave the medications that I needed, and I wrote a report to the police, and thinking that they followed it up, right? Because what I was waiting is when it will get, if they want to go to court, they can now call me. I won't be the person going to the police station and all that. They took the paper and left. So I believe that they were on this. Only for me, about 4 months or 6 months after, this lady came to me. Yes, you heard me. And said, Doc, please, I need you to rewrite, because what happened is that was a primary health care, right? So by the time, it was nurses that were manning the place. So when doctors came in, they were still writing in the paper. I wasn't comfortable. That's not how I was trained. I am supposed to document my thing on the case notes, and it will be filed in the hospital. But what happened, what I saw there was, when you come, the person that is coming for treatment brings a paper. So you write it on the paper and the person takes it home. So I took that up. But eventually, before you could know it, I made sure that our supervisor brought in a paper. But by that time, that was my first, like, few days of consulting in that place. So I was still writing on that paper. She said she has lost the paper, so she need me to document again. Guys, how am I going to remember all that I did some months ago? I was like, but I gave you the paper. She said, yes. The husband who took the paper. I'm like, ma, that's not how it's done. No doctor will come, sit down, and remember what we write on what we see. And I know I wrote that thing, gave you a paper to the police. Didn't you go to the police? Said no. The husband refused, that they cannot go to the police. It's his family member. So you see, this is what happens every day of our life. So that's why I decided to talk about this topic today. Okay? So if you have known anybody that have had child abuse, comment on the comment section. Those on Instagram, those on Facebook and YouTube, comment. Tell me, have you ever seen anybody that has been sexually molested before? If somebody has been sexually molested, what did you do as a person? Did you just, like this father, leave this child to be out there and suffer something that he or she didn't do? Or did you follow up to make sure that the right punishment is meted on the people? So without much ado about anything, let us dive into child abuse. All right? So child abuse can be any kind of neglect. It can be an emotional abuse. It can be a physical abuse. It can be sexual abuse on a child or teenager. Okay? Teenagers are also children. Now, there are so many key signs and symptoms that you will see that will point to the fact that some child or some teenager is being abused. Okay? Number one is if the child is frequently absent from school. Yep. If this particular child that has been in a school as a teacher, your student is no longer coming to school and is no longer in school, that's a sign that that child is being abused sexually. If the child is begging and stealing food or money, other children will come to school, he won't come with any food, especially for schools that don't get food ready for children, and this child keep on stealing children's food, stealing their snacks, stealing their money that their parents give them for recess so that they can be able to buy some things to eat or buy lunch in the school. If you see a child doing that, or your children have started complaining that there's this particular child that is always stealing our food, that's a sign that the child is being abused. Because come on, which parent will not prepare food and put on a child's lunchbox to come to school? Or if you don't want to give the child food, at least you give the child money so that the person will have something to buy. So when others are eating, the child will not eat. So that is why that child is stealing from the others. That's another sign to show that a child is being abused. The next thing is if the child needed medical or dental care. Your children come in, or you go to the church and you see this child with cavities all over the teeth. Okay, the child is having body odor, the ears are all dirty. If there's any sort of this, or maybe as you're talking, the child is showing some deficits in the medical things that a child of their age should have done. Let's say, oh, the child hasn't taken immunization and things like that. That is a very, very big sign, because I mean, which mother or father will not encourage that their child go to have the medical need that that child deserves? Okay, now if the child is not getting vaccinated, all right, or there's missing immunization record. Let's say this child is being admitted into the school as a teacher. You say, oh, these are the things that we need. We need the immunization record, and this child doesn't have any immunization record. This child have never taken any immunization whatsoever, or their story of, oh, I don't know where the immunization card is, and things like that. When things like that start happening as a teacher, that's a telltale sign that this child have been abused. Okay. If the child cannot see very well and supposed to have glasses, and this child is squinting the eyes all the time when you're teaching but doesn't have a glass, that's a telltale sign to show that there is a kind of abuse going on. Or if the child used to have glasses and suddenly there's no glasses, and the parents didn't even bother to go and get another glasses for that child, that's a telltale sign that there is abuse. All right. Now, if this child is constantly and persistently dating, as a school nurse, this child comes in every time the clothes are torn, dirty, rumpled without being ironed. All those are things showing that there is something going on in this child's life. And then the child is having body odor, smelling whenever the child passes. Those are signs, because there's no parent that would just be careless this way and not make sure that the child is properly kept clean before bringing the child to school, right? Now, if the child comes in, it's winter period, and instead of wearing jackets that is winter friendly, right? Or now that fall is coming, or even during summer. During summer, the child will just wear a big sweater or a winter jacket. Nobody is taking accountability to make sure that this child is properly dressed for the season that you are in. That is a telltale sign that there is abuse. If this child comes into the school as a teenager or a child, they come into the school and they realize that, oh, this child is smelling alcohol. Smell of alcohol is coming on a child that came to school. Come on now. Or there's a sign of puncture wounds with syringe. Okay? Oh, the child can even tell the other children that he is taking any of the illicit medications. That is a telltale sign that there is an abuse, and probably the child has seen that, okay, I need to use this thing to calm myself down, and that person will start being addicted to taking any kind of drugs or smoke or take alcohol. All right. Now, listen, child abuse is something that is really, really, really terrible. And we, as neighbors, as brothers and sisters, and as family, must do our very, very best to make sure that we do what we can to protect these children. Because guess what? A child is a child. There's absolutely nothing a child can do. Just imagine the one that happened and it streamed live. Okay? The case was streamed live in Netflix, and it happened in Los Angeles, United States of America, where this Isuaro Guerre and the mother of Gabriel Fernandez connived together and dealt with this 8-year-old boy. Now, Gabriel is dead. Yes, they got the jail terms that they deserve, but this child is already dead. So does it mean that the teachers didn't pick out any of these things that I mentioned when this child comes to school? How a child will be on his own. He won't play with the children. He's just going to be one place. Abuse can be anywhere. Even the teachers can even be the source of abuse to children. So please, it is very, very important that we take note of these signs and symptoms. The next one is signs that you're going to be seeing if a child is emotionally abused. Okay? The child will show extreme behaviors. The child will either be very, very angry at all times or very, very, very smiling. Any little thing the child smiles without any reason for that smile. Or the child gets um overly complaining of so many things. If you do this, no matter how well you do that, the child complains about it. The child demands a lot of things from people around them. Okay? And then this child sometimes will be very, very aggressive. When you see an aggressive child always fighting the other children, fighting and getting so worked up, know that there is an abuse that this child is passing in the house, that she is now or he is now trying to pass to another child. So when you see that child that is always beating another child, know that there might have been a kind of abuse that that child is passing through. Okay? Now, um, if you see a child, the child goes to school and keep on doing bizarre things, such as maybe hitting his head on the wall, or causing a lot of things that are not normal, that might be the sign that that child is showing you that something terrible is happening in the home. That means that child is having some emotional abuse. Okay? If there is a delay in physical or emotional abuse, a child that is supposed to have started eating by himself, developmentally, the child is not eating. The child that is supposed to start talking, developmentally, at the age range, every child there is talking. That child is not talking. That shows that there is a form of abuse that that child is passing through. Okay? So we all need to be very, very attentive. Especially even if your child comes and says, "Oh, mommy, there's this child that is always fighting and hitting somebody." Know that there is an emotional abuse going on. Either the child is seeing the mother and father fight all the time, or they are beating him. So that is his own way of also trying to beat another child or molest another child. Okay? Now, the next thing is, if a child has attempted any form of suicide, or that child is talking about suicide, talking about how, people are committing suicide, how he will want to commit suicide, or even in their laptop, you see them, they talk about anything laptop, in their chat with their friends, they talk about suicide. If your child has mentioned to you that, "Oh, I was chatting with my child or my friend on the internet, and he said, oh, I feel like committing suicide," please report that case, because there is an emotional abuse that that baby is passing through, or that teenager is passing through. All right? Now, let us talk about physical abuse. Okay, we have talked about emotional abuse, so we are talking about physical abuse. What are the signs and symptoms you're going to see to tell you that, oh, this child is having a sort of physical abuse? Okay, if this child have an untold, or a mother said, "Oh, I was trying to cook and the child touched there and had a burn," any sort of burn on the body of a child, both on the fingers, on the hands, on the face, on the body, any part of the body that have any kind of burns, it means there is something that is happening in that house, and probably some adults must have poured a hot water on that teenager or child. Okay? Come, let's think about it. You can't go and tell a little girl or a little boy to go and get you a hot kettle on the firewood. So if by peradventure the child goes to carry that, a 2-year-old, 3-year-old carries the burns, the hot water, and there's a burns injury, You're not going to tell me, oh, it was a mistake. Okay? Especially if that burns injury was not reported to the hospital. If you notice that a child has a burn injury, make sure you follow up to know what this thing is all about. If there are bite marks, okay, bite marks on the body of this child, because there are some adults that can actually bite their children. Yes. So these are signs that you're going to see that is showing that this child is having a physical abuse. Are there bruises on the body of this baby? Let's say when the parent is pulling the child on the floor and there are bruises on the body, or if this child is constantly having a sort of fracture, breakage of the bones, okay? If a child constantly, oh, the other day the mother comes and says, oh, the child fell from the staircase, oh, the child fell when we went to the playground, and there are issues of fracture upon fracture upon fracture, or the child comes in and there's a black eye, and the mother is saying, oh, no, 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 what caused the black eye is because he hit his head on the door. That is a very serious sign for a child to have a black eye on any of the eyes or red eye on the conjunctiva. It is showing that there is trauma to the face, and that means the eyes of the child was hit either with a hand or with and equipment. So please, these are the things that when you see it on your child, when you see it on a neighbor's child, when you see it on your children's classmates, please, it is a telltale sign that you cannot keep quiet. You must report to the right authorities. Okay? Now, all right. So if, let's say, this is holiday, right? Probably they have abused this child during the holiday and school is about to open, and you're seeing a bruise that is fading away. Okay, the child comes to school and there's a serious bruise on the body, but it has started healing and fading away. That's a sign. You must pick that up, tell the teacher, or if the teacher is not doing anything, you can actually report to the child protective agencies. Let them come and do investigation to find out what actually happened. Was this bruise something that this child did by himself, or was it perpetrated by an adult, the parents, the relatives that are around, or the foster parents? All right. Now, if this child feels frightened all the time, you're asking the child something, the child is forgetting, shaking. When you see that on a child, make sure you don't just keep quiet, because children are always very eager to talk. They don't get afraid. Any child that is showing a sign of anger or a sign of frightening, shaking, there is something that child is going through that you need to find out. Okay? Now, if a child sees an adult, instead of saying hi, the child shrinks and start being afraid, showing a serious sign of being afraid. That is also a sign that probably that child, whenever the parents come in or whenever the person that is abusing the child comes in, the child is frightened. So it's going to be in a kind of voluntary action that the child does whenever she sees or he sees any other child. Okay? So that is a sign that something is happening. Next thing is, if this child comes to you and asks you, ma, please, what will you do if my parent or somebody's parent beat them? If a child is asking you about such questions, about what to do, or do parents, is it good for a parent to beat a child? Call that child closer and ask, okay, so now that you are asking, find a way to communicate to that child. The child is going to open, because children don't even know how to hide a lot. The child is going to open to you that, oh, I've been abused, I've been beaten all the time, and that will make you to escalate that case. Okay? If there's report of injury by a parent or another, okay, about this child, or an adult in the neighborhood comes and tell you that, look, I am always seeing a sort of injury on this child, please, as a teacher, as a friend, as a relative, that somebody has told you that, oh, this your relatives' child that I'm seeing there, I am always seeing bruises on their body. Please, I plead with you, don't just look away. Okay? If somebody had seen Gabriela Fernandez with all these things and had reported it, even to the mothers, sisters, and brothers, or even reported to the social services, Gabriel Fernandez would have been alive, just like any other child that has been abused for the longest time. All right? So now we have talked about physical abuse. Let us look at the signs you're going to see when a child is having sexual abuse. Number one, the child will have difficulty walking. Okay? Like that case I told you about, this child that couldn't talk very well that I saw. The mother said the first thing she noticed was that the child, when she's walking, he is going to be, the child was wobbling, okay, will not close the two legs. So that was where she even called her and said, "What is wrong? Do you have a boy?" She said no. Initially, she didn't want to say anything until when she continued probing and probing, she now opened up to say, "Oh yes, this boy was molesting me. He used to carry that thing here and put inside her place." Okay, so whenever you see a child that is not walking properly, that is a telltale sign that that child is having a sort of abuse. So for you, you don't need to examine it. All you need to do is take that child to the hospital. Let's say that you are even a mother and you have gone to work and you come back and your child is wobbling and it's only your husband that is in the house. Please take that child to hospital. Let the doctors examine. The doctors have the tools and the expertise to be able to identify who is being molested, who is being abused, and things like that. Okay? Now, if this child refuses to change into gym, you take your child to gym. He is wearing his regular clothes, right? You now go to the gym, or even in the school, sometimes they do sports, and this child is supposed to wear the swimming trunk or gym clothes, and this child refuses to change. That is a telltale sign that something is wrong. Probably the child is trying to cover up either the bruises that she has, or she will feel that something is going to be picked when she removes the clothing. Okay? So please, if this child is doing all these things, there is a sign of sexual abuse. Now, if the child is sort of withdrawing from physical activities, you will come to the school and you ask the children, it's time for recess. This child stays behind. She doesn't want to go and play with the children. Or if you take your children to park and the child is not always wanting to join other children to play, she is being withdrawn or he is being withdrawn, that is a sign that something is actually going on. There's a kind of sexual abuse that is going on. Now, if this child that has already been trained, potty trained, the child goes to the toilets and urinate, and suddenly this child starts bedwetting, that is a telltale sign that something is wrong. Okay, so do not look away. Oh, this child continuously every night, the child is going to wake everybody up shouting and having nightmares. Okay, if that is happening, a child constantly that wasn't having all this kind of problems start complaining of nightmares and all that, bedwetting and all that, please know that there is something actually going on. Do not look away. It's better to catch them as early as you can so that therapy can be done to that child, so that that child will go back to being the child that he or she has always been. All right? If the child that usually don't eat very well start eating a lot and start adding a lot of weight, or the child that is obese, chubby, starts not eating a lot, and you start noticing that the child is losing a lot of weight. So either excessive eating or reduction in eating, especially in a child that was normal before, and all of a sudden you bring food, the child will be mute, looking at that food without eating it. Or the child is obviously now going everywhere in the kitchen, eating a lot of food. These are the ways the child is trying to run away, or something to give her solace, something to give her strength, something to make her take away her mind and brain from the abuse, the sexual abuse that this child is having. So when a child is having all these things that I told you, know that there's a sexual abuse going on. Grab that child nicely, talk to the child. If the child can't open up to you, bring the child to the hospital. Let the doctors do what they are trained to do to identify that these children are molested, and adequate and appropriate action given to the perpetrator. Now, if the child start exhibiting a lot of sexual activities, bizarre things that you as a parent you didn't even teach this child. Let's say you're watching TV, the child comes to you and lie and start thrusting himself up and down, or you're lying down and the child lies on top of you and start moving up and down as if he's having a sexual activity. There is somebody that is sexually abusing that child, because a normal child doesn't know what sex is. So how come the child is now doing bizarre things that you have never even, you don't even show them that kind of TV, you don't even make them see things like that, especially when you are having sexual activities with your husband. They don't even know. You have your own room. So where did they learn the bizarre things that they are exhibiting? Obviously somebody is teaching them and somebody is abusing them. So it is very, very important. When you see these kind of things, you must, as a matter of urgency, take that child to hospital and examine. And when you examine and it is found that this child is sexually abused, please make sure you guys take that up, take that to social services, to the police, so that the perpetrator can be brought to book. Because guess what? If you don't bring this perpetrator to book, after doing that to that child, pedophiles, it's not written on their faces. It is going to continue. He is going to find another victim, and this act is going to be on and on and on and on. All right. Now, the most important one: if a child suddenly becomes pregnant, okay, or contracts sexually transmitted diseases, particularly if this child is less than 14 years, there's definitely somebody that must have impregnated her. There's definitely somebody that must have caused her to have this sexually transmitted disease. A child cannot have chlamydia infection, cannot have gonorrhea infection, cannot have syphilis without being that somebody had sexual knowledge of her, because these are sexually transmitted diseases and infections. So when a child have infection, what other way did the infection come up? Or if a child is pregnant, that one is even the most. So we can't wait until that child becomes pregnant before we report this case, can we? So that's why I listed all these things that you are going to see before the time that the child would now start complaining of, oh, I can't walk again, I'm having pain on my vaginal area, I am pregnant, I did a pregnancy test and it is positive. Another telltale sign is if a child all of a sudden runs away from the home, runs away. A child that is being treated well can never run away from the home, would they? So probably there's somebody that is molesting that child, that is abusing that child. She cannot talk anymore. He can't say anything. The child had to run away. So when a child runs away, don't start beating that child. Find out the reason why this child ran away from their home. There must be somebody molesting her, either the father, the mother, the brothers, the cousins, the relatives, or even people that they brought in from outside. All right? Now, when you have any form of sexual abuse and this child had told you, you are not the parent, the child has told you, I think it is on you to tell the parents. If you tell the parent and the parent did not do anything, that is then the time for you to go report to either the police or the child protective services. Because guess what? There are some parents, just like the one I saw in my hospital, that covered up with this case. Despite the fact that the mother found out that this child was being abused, the father closed up that case because the perpetrator is his own relative. I bet you, if that perpetrator was a relative of that young lady, the father wouldn't have kept quiet. Okay? And the solution could have been preferred and given by reporting to the police. And this child or the boy would have been dealt with, given the punishment that they deserve. All right? So now that you know, if you as a neighbor, as a relative that have come to the house, and you have seen all these signs in this particular little girl, it is on you to report. Because guess what? If you don't report, you are part of the perpetrator that is causing this abuse on this baby. Okay? If eventually the police finally find out and know that you knew about this case, you will still be given the jail terms and punishment that the perpetrator, yes, excuse me, yours might not be as bad as the perpetrator's own, but you will still be punished for just allowing this child to be molested without complaining. Okay? Now, if you know that a child is in an imminent danger, as a neighbor, as a relative, as a passerby, it is on you to report. Because if you don't report and this child gets bite, just like this Fernandez boy was bite, you will be accountable too. Because if the police actually find out that, oh, you knew that this child is in imminent danger and you did not say it, you will be brought to book. Okay? So do not help to cover up these perpetrators. When you have any sort of suspicion, it's better you report and the police come in and find out that, oh, he was just a child that is being, handled by the parents so that the child will be good, than you keeping quiet and you know that this child is in their problem. Okay? It's facing a lot of abuse and you keep quiet as a neighbor. So now that you know, please, guys, get out there, open your eyes wide, your ears alert, and pick everything that I have mentioned now so that when these children are abused, the case will be reported on time and everybody will take cue and do what they can to protect these children. Because guess what? These are children. They actually don't know much. They are to be taken care of and protected by me and you and their parents. And when the perpetrators are even parents, it's even the worst one. Like this Fernandez own that streamed in Netflix. Can you imagine a mother being abusive to her own child because of her boyfriend? If you don't need this child, hand this child over to child protective services so that this child can be put for adoption. Assuming you feel now that this your girlfriend, this your boyfriend is all and all for you, you don't care about your child. Children are supposed to be protected. Hand over these children to the government. Let them give them to foster parents. There are so many people out there willing and ready to foster these children as parents. So why kill your own child because you feel that your boyfriend doesn't like the children? It's okay to give these children for adoption. So now that you have known, I implore you all that are listening to me now to please, 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 let this be a wake-up call for all of us. Because guess what? If that perpetrator goes unpunished, you don't know whether it is going to be your child that he is going to come after. Because guess what? A pedophile, if not treated appropriately, will go look for another victim, continue looking for another victim, continue looking for another victim. And who knows who the next victim is going to be? Probably your child or mine. So the earlier we do the right thing to get them out of people's home, the better for all of us. I am going to stop here. I hope you have learned so much and I hope you have also shared this video for people to listen and learn what it takes to be a proper guardian, a proper parent, so that whenever these things happen, you will be the person that will report this case on time and appropriate action be done to the perpetrators. So now, comment on the comment section if you have seen anybody or know anybody that has had all these signs and symptoms that I mentioned before. And now that you know, what are the things that you're going to do when you see that a child is showing all these signs and symptoms that I mentioned in this video? Are you going to just look away, or are you going to do the action, which is report the case? Your guess is as good as mine. Definitely you're going to report the case, right? So please kindly share this video, share, so that people will listen and learn the telltale signs of a child that is going through abuse, so that when they see all these signs and symptoms, it can be reported on time. All right, so we have come to the end of the discussion about abuse. Now we are in my favorite part of the show, which is my question and answer series. So now, give me what, in your own words, child abuse is. What do you think child abuse is? Comment on the comment section. If you comment right now on this live, for those on Instagram, for those on YouTube, for those on Facebook, any one of you that answer this question, it means that you have paid attention and you have listened. You are going to be a lucky winner of my giveaway. And guess what? The money is going to get into your account if you answer well. So, what do you think, in your own word, is child abuse? Number two, what are the signs and symptoms you see when a child is having emotional abuse? Just give me two. Number, the next question is, what are the signs and symptoms you see when a child is having physical abuse? Two. Okay? And what are the two signs you're going to see if a child is having sexual abuse? Isn't that simple? So if you know the answer, just comment on the comment section and I will do that answer right now. But guess what? The good thing is this is fastest fingers. If you don't know the answer in this live streaming, go back to this video, watch it to the last, and pick these answers. When you get these answers, comment on the comment section. My team will look and find those that answered correctly, and you will be communicated. Or better still, if you have answered it, send me a message on either my Facebook Messenger or my Instagram Messenger, and I will credit you. If you send that message and send your account number, I will credit you for answering the question. How cool is it? Isn't it wonderful that just for answering my question, me that is supposed to be paid, I am also paying you? But guess why I'm doing that? So that I know that this message I'm passing every day that I come online is being assimilated, is being passed to people around. Then, when you answer these questions, don't forget to like, share, and always tune in so that you will listen to the topics I am going to discuss. Listen, this is a very, very serious topic. Child abuse is happening as we are talking. There is a child that is being abused right this minute that we are talking. Yes, all over the world. It is statistically proven that for every minute that passes, a child is being abused. I don't know whether you guys saw that video of one particular girl that was flogged, that everywhere in her body was all swollen. Did you all see that picture or the video? They took the child to the hospital, to the police, and the woman was saying, I don't even know what she was saying, that the girl did, that made her beat this girl blue, black, and purple. All right, so child abuse is happening. Let us be that agent of change that will report these people and put a stop to child abuse. All right, my last doctor's orders today is, be vigilant. Do not leave these perpetrators to keep on harming these children that are harmless. Be that protector. Report every child abuse that you know. It's better you report and that child is examined physically, sexually, emotionally, and all the facets of examination is done, and we find out that nothing has happened to this baby. That will be a good thing than keeping quiet, because the more you keep quiet, the more these perpetrators keep on abusing children. I'm going to stop here, and I am waiting for those that will answer my questions. For anytime you see this video, answer these questions. When you answer them, just send me a back channel. Though even when you answer them, they either in Facebook or YouTube or Instagram is going to send a message. I will have a notification that you answered this question, and I will contact you if you didn't contact me, so that you send your account number and the appropriate action will be done. So I'm going to stop here. Be vigilant. Be that agent of change. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Thank you for listening. Ciao, ciao. Bye bye. See you soon.